out of that. Now we go from good news to another kind of news, because joining us on the air and also on SuperTalk TV on C Spire TV Channel 70, your Amazon Fire TV, and your Roku device, Dr. Jennifer Bryan with the Mississippi State Medical Association. Dr. Bryan, how you doing today?
Hey, I'm fine. Thanks for having me. How are you doing?
Doing quite well. The numbers today came out, and, well, they're not as bad as they've been recently. When that's the best thing you can say, that might not be the most cheerful leadoff, but that's about all you can say in this case, right? 1,732 new cases, 56 new deaths reported, and the long-term care facility outbreaks at 206, which is probably the most concerning number that we have to deal with. Give us an overview from your perspective, how things look, where we're at, and where we're headed right now.
Yeah, thanks for having me, and thanks for asking that question. Certainly agree with you that the numbers could be better, and we hope that in time they will be better. But right now, for the next few weeks, we do foresee some, unfortunately, grim times. So the 56 death number, I think, was the one that jumped off the page at me the most. We're starting to see the repercussions from Thanksgiving and some of our gatherings there. The cases. We look at cases, and we are seeing that on the ground. We're seeing that more in the clinics. We are seeing that number go up. The trend is going up. From day to day, we pay attention to that, the bobbles, but the trend is still going up. Certainly, we all remember the days when we thought, 200 cases was a huge deal, and now to be hanging around this 2,000 mark, give or take, these are scary times, and it doesn't have to be this way. It really doesn't, which is it's the hardest thing for us to get out, is that if we will just do the simple things, we really can knock this back to a manageable level. Christmas is before us. One of the things that was, I guess, better about Thanksgiving and the risk there was that, we had Thanksgiving itself and then the weekend, and then we were kind of back at work. Christmas usually extends itself, and you have Christmas, the days before Christmas, and after Christmas we get together. So real concerned about our risk going into that holiday and all the festivities associated with.
Well, exactly. And the numbers are troubling. We've heard a lot about hospitalizations and the stress on the healthcare systems in the state. Do you have an update on that?
Certainly, our hospitals continue to be full. ICU beds are hard to find. I know this sounds really morbid, and I hate I'm always the bearer of bad news, but when you see 56 deaths, what does that do to your ICU capacity? Part of the way that we're managing ICU capacity, unfortunately, is the death number. And so that's going to always be there to offload that capacity, but we don't want that. We don't want to ever have to get there, right? So we continue to struggle. We've got patients in emergency rooms that are doubling as ICUs. That's not a one-time occurrence. That's becoming fairly standard in several facilities now. We've got hope. I always like to preach that message of hope. There's a lot of good things coming, but there's nothing coming to save us before Christmas in any widespread capacity except our own behavior.
Well, I've had, over my career, I've had a lot of doctors on the air with me, and we've sat down and had conversations. But before this year, it's been about the flu. That's been the big conversation was, we got to watch out for the flu because it will kill people. It does every year. And it's a very serious disease, and you don't want to get it. And I keep coming back to this. Everyone is getting hung up on the masks and mask mandates and mask this and mask that. And you can't make me do that. And why wouldn't you do this? Let's drop back to last year, as I keep saying. Wash your hands and stay away from people. That pretty well solves the crunch in the hospitals, doesn't it, if we just do those two things?
It does. I mean, if I'm just being candid, this whole political situation with masks is just nauseating. I mean, it is really, why would you not wear a mask? What would you do to save 1,000 lives? That's the message that Dr. Dobbs is giving us, that if we would just mask up, get away from each other, wash our hands, we could save 1,000 Mississippians by the end of the month. Why would you not do that? It is, in my personal opinion, and I'll rant a little bit, adolescent at times to just demand your way with no awareness of what you are doing to other people. I get it. I don't want big brother or big government telling me more than they need to tell me. And so that's all the more reason just to do the right thing. Do the right thing because you know in your heart that it is the right thing to do, that the doctors are asking you to do, and nobody has to force any issue. But instead, we've gone into this madness of fighting about a mask. Well, there's regulations in every aspect of life. You're not allowed to drive down the wrong side of the road in oncoming traffic because you might hurt someone else. You can't drive drunk because you might hurt someone else. When you go to a restaurant, you need to wear clothes. That's a hygiene hazard to other people. So this mask situation with a deadly, highly contagious virus, I, I will never understand why we cannot find it in our hearts as humans to just get past that. Wear it, do the right thing. But it's not just the mask, it's all of it. I mean, the holidays are exceptionally hard. It's cold. We want to be inside. We know the virus likes crowds. The virus spreads 20 times more, it's 20 times more likely to spread inside than outside. So these things require us to be even more vigilant and to spread out more and to implement all of the things that we know, which are the holidays need to look different this year. My twins turned 10 this week. We had a Zoom birthday party with family. It was fine. We got through it. We're not traumatized. Was it my favorite thing ever? No. But we celebrated and it was fine. So problem solving is going to be important so that we have multiple other celebrations in the future together.
You know, you bring up a point that was made, I think, by a meme that was going around and said, do you remember all back in the good old days of last year when we would let somebody blow all over a cake and then everybody have a slice? Those are kind of gone now. Those days are behind us.
Somebody sent me a cartoon this morning. It was I can't remember the character, but it was a girl hollering out the window. And she said, "This is just to let all of you know that I'm throwing a party and nobody's invited." That's the way I felt.
Dr. Jennifer Bryan with the Mississippi State Medical Association. Now, what do you have to say to the folks? Because we still have some that exist. We see the comments all the time. Well, this virus, it has like a 98%, 99% survivability rate. So it's not that big of a deal. Why are we making such a big deal about this? What's your response to that?
So let's talk turkey a second. It's never been about the death rate. It's never been about that. It's been about the doctors and the nurses and the hospital capacity and not overwhelming these people. These are your neighbors, your coworkers, and your family members, and they are stressed out and traumatized by what they're seeing. We need to be able to provide proper care. In the end, when we look back and we figure out whatever the death rate is, we'll figure it out. History will look back. We know that the Spanish flu back in 1918 was about 2%, give or take. We will know what this death rate is. Nobody's chasing that. It's hospital capacity, and we're overwhelmed. Right now, we are overwhelmed. Now, you may find a bed on the coast or a bed in Tupelo or a momentary break where somebody can say, right now we have capacity, but the people are tired. These caregivers are tired. Part of this, you've heard me say it before, is the psychology of a pandemic. Just like somebody grieving the death of a loved one, we are grieving the deaths of thousands of people. And we don't want to believe it is as bad as people say it is. And so this is part of the denial, right? But it is as bad as
Dr. Jennifer Bryan, we're up against the break. We'll continue this conversation if you can stick around anyway. Can you stick around?
Sure, I'm here. Yeah,
okay.
Absolutely.
Got some of that birthday cake left when we come back from the break? Are we going to interrupt you mid-bite? Have a little frosting on your nose, maybe?
I've got more leftovers than you can imagine.
I have no doubt. Dr. Jennifer Bryan, we will continue with her next. This is Dr. Jennifer Bryan with the Mississippi State Medical Association. Dr. Bryan, everybody is excited about the appearance of the vaccine. The problem is, I think we need to temper those expectations a little bit, because when we say the vaccine is available next week, that doesn't mean you're going to be able to go get it. This is going to be a staged rollout process, and we're not even getting as many doses in Mississippi as we originally thought, are we?
No, and I appreciate you bringing that up. You know, it's so exciting. Like, it's very exciting that the vaccine is coming, and our doctors are here in Mississippi are poring over the latest information. As recently as this morning, we were looking at the Pfizer data from the FDA and just combing through it all. we feel very comfortable with what we're seeing, and we're excited. And the Moderna is coming out later this month. We hope to get some doses here in Mississippi about that. So first thing I want to say is that I'm going to get that vaccine just as soon as humanly possible. Just as soon as Thomas Dobbs lets me get it, I want it. And I'd encourage everybody to consider that the same. But the other piece is that we do need to temper those expectations. I'll say again, our behavior is what we need to get us through the holidays. The vaccine is not going to save us from the virus over the holidays. We've got to get that in check. But I would expect come January, February, this is going to roll out in more regularity and more volume. And we're watching everything. I'm watching the national scene as well and the international scene with vaccine distribution, and we see the hiccups. But I still have a whole lot of hope and a lot of faith in Thomas Dobbs' leadership that we're going to get this to the people.
Well, and from what I understand, and correct me if I'm wrong on my figures here, we were originally expecting to get way over 100,000 doses of the vaccine in this initial rollout, which is coming by the end of the week, first next week. And now we're down to, what, about 25,000?
I've heard that, and I have not seen the numbers myself, so we'll go with yours if you've seen that number sooner than I have seen it. But I will say that nationally, I have heard that we were expecting more of a flood, and we're getting more of a trickle. It's disheartening, but I don't expect it to trickle long. That's what I'm hearing. So I expect that this is going to ramp up. But if you just step back a second from Mississippi and you look at the globe, and you look at the globe being on fire with an infectious contagion, and you look at all these countries that are warring to be first for a vaccine and you can see where the demand on supplies and production and it's just mind-boggling if you think about the scale of what's going on. So I call these hiccups. You got to expect the unexpected in life, but you also got to problem solve and get through them. And our governor, our elected officials, the legislature, all of these people, whether or not I agree with every step of the way of everything that everybody's doing, I do know their commitment is stellar, and they're working with Dr. Dobbs every day on making sure that Mississippi has the best chance at these vaccines. And I'm not disheartened. I do believe that we're going to get these sooner rather than later. But again, we'll stress that it's not going to save us from the holidays.
It's not going to be here in time, especially when you consider that some of these vaccines, especially the one that we're getting first, is the vaccine, correct me if I'm wrong here, that you have to have 2 doses before it takes effect, with about 3 weeks in between those 2 doses. So it'll be after the first of the year before you get that second dose on the very first people that receive the vaccine, right?
Right, and we think it stands to reason that you have some immunity after that first shot, but certainly the full immunity would come after the second one. And you go on and start teaching about that it's very, very important to get that second vaccine and not drop off after the first one. But we have had a lot of wishful thinking in 2020, and we're humans. We're dealing with a collective trauma. We want the good news. I want to bring the good news. And there is good news coming, but the message really is vigilance and personal awareness and how we interact. And I started early on telling my kids, just keep being weird. just keep standing your ground, right? About wearing the mask and social distancing. It will come home to roost. And we're seeing these things where, okay, the vaccine is not quite as optimistic and glitzy as we thought that it was on a timeline. That's okay. But I'm a realist here. I'm a physician. That's what we do. We're going to teach realism. It's coming. It's very exciting. It's going to be next year in large part.
And one thing we can't lose sight of, and I've talked about this before, is part of the problem this year is that for the first time in my memory, in terms of medicine, science has been happening in front of everyone in real time, and that's not the way it usually works. So a lot of people are confused because they're thinking, oh, well, I've never seen anything like this before. It's always been this way. It takes time, and this is a record-breaking pace that they have developed this thing at. Do you think that can lead to any problems because they did compress the time into such a short span?
No, it's been interesting. Through my association with the State Medical Association over the years, we're also, I'm a delegate to the American Medical Association, and there have some contacts on the national vaccine committees. And and have really been studying this and hearing from the experts. I mean, I would label myself an expert messenger, but I hear from the vaccine experts. And these guys, they just explain it so well. The science is sound. When we talk about things that were skipped, we're talking about, I mean, not the science piece. It's the time that we took in getting things approved or building manufacturing facilities. And they poured cash and manpower into this vaccine production like we've never seen before. So the science was not compromised. The safety was not compromised. It was rushed. That does not mean shoddy work. And our physicians, we're pouring over this stuff, and what we see is standard medical science that we believe in and that we are encouraging the population to get. When you talk about known outcomes in life, we know what happens with COVID-19, and that's a risk we don't want to assume. And everything looks great with these vaccines. The science looks to be very sound, and it's just wonderful. I mean, 94 and 95% immunity, that's unheard of. That exceeded all of our expectations. It's the silver lining that we want. So I'll say again that I'm excited about this, but I want to double back on the realistic message of December, and that we need to be figuring out our holidays. We need to talk to our loved ones and have those conversations about we're going to do Christmas a little differently this year, and be comfortable having those discussions. You see today, again, 56 people died in Mississippi, and this is part of our Thanksgiving numbers, and I don't think we've seen the worst of it. Christmas right now is predicted to be darker.
You're talking about that. We just heard what you're doing, what you did for your twin's birthday. I assume you're going to have a quiet homebound Christmas as well, right?
We are. We did for Thanksgiving as well, and it's uncomfortable at times because not everybody is following the science as closely, right? You've got some people that are all about it, and some people are dealing with this trauma with denial and ignoring it a little bit. So these make for some awkward conversations, but I want to encourage people to have them. And I think it's going to normalize more, unfortunately, as we see over the next few weeks some of the fallout from Thanksgiving. People will begin to understand that we're going to have to do Christmas differently.
Now, one final thing, back to the vaccine just very quickly. You say the science is sound, even though it's been rushed. Have we seen anything where there could be some bad effects from this vaccine, some side effects?
No, and part of that's just the way that, these vaccines, without getting too technical, it's basically a message that tells your body to create the antibodies. So you're teaching your body to create its own immunity. So it's an interesting vaccine technology, but we don't expect long-term problems from this just from knowing the science and how it works. These are fascinating vaccines. The research is not new. This is something that's been studied a long time, and so I think we're all going to be quite pleased with the effects of these vaccines. And I've seen our immunology and epidemiology, infectious disease colleagues pouring over the data, and it's just nothing but good news so far on all these vaccines. I mean, it's been given to tens of thousands of people. They're doing well, and again, I'll say that I'll get my vaccine just as soon as they'll let me.
And until the vaccines get here, your recommendation, stay away from everybody because they're germy.
But seek joy, right? I mean,
yes.
Don't get depressed.
From a distance.
We've got to be smart.
Dr. Jennifer Bryan, Mississippi State Medical Association, we appreciate your time. And have an extra piece of cake from me. I told you to do it so the calories won't count.
There you go. Thanks for having me. I always love being here. I really appreciate the platform to talk about all of this.
Anytime. We'll talk to you again soon, Dr. Jennifer Bryan.